New Year, Guyana, the Ministry of Health is delighted to bring to you another year of the Week in Review. Stay tuned as we share with you the highlights from the past week. As the ministry continue efforts towards upgrading service delivery across the country, on Monday, January 6th, Minister of Health Honorable Dr. Frank Anthony attended the recommissioning of the East La Penitence Health Center, located in central Georgetown. This marks a significant step in the ministry's ongoing commitment to improving access to quality healthcare services while serving a population of 7,651. Minister Dr. Frank Anthony, during his remarks, highlighted several critical programs that will be available at the center, including expanded vaccination services for 19 preventable diseases, school health screening with corrective care, advanced chronic disease management with HARTS and HbA1c testing, and infectious disease monitoring through accredited testing and surveillance by the Pan American Health Organization. He expressed his enthusiasm about the enhanced services the center will offer. This is what he had to say.
We have been able to improve what we are doing at the primary healthcare level, and over the last maybe 3-4 years, we have worked with the Pan American Health Organization to decide what would be a basic package at the level of a health center. What are the services that we should provide at the level of a health center? And we came up with a package of 115 different interventions. And that's what we aim to provide at all our facilities across Guyana.
Tuesday, the minister recommissioned the Kamwata Health Post in Region 1, valued at approximately $14 million, which is geared to serve a population of 320 and other surrounding communities. While delivering the keynote address, he highlighted the major investments made in healthcare infrastructure and services within the region in the last few years.
We started out in 2022 by assigning approximately $100 million directly from the ministry to help to improve infrastructure. By 2023, we increased that to $200 million. And in 2024, that went up to $500 million.
Following this activity, Dr. Anthony embarked on a walkabout to the Kumaka waterfront and visited several departments within the Mabaruma Regional Hospital. He also toured the wards where he interacted with several persons who are currently receiving care at the institution. During his time there, he inspected an 80 million Siemens digital X-ray machine, which was procured for the hospital and will be installed in a few weeks. Wrapping up his visit to the region, Minister on Wednesday commissioned a 14-bed maternity waiting home in Mabaruma, which aims to improve maternal health outcomes by providing a safe, supportive environment for expectant mothers, particularly those living in far-flung areas. This $46 million investment is part of the Health Ministry's broader initiative to enhance maternal health services in Region 1. This initiative includes training healthcare providers, increasing access to prenatal and postnatal care, telehealth services, and increasing awareness and education about the importance of maternal health. Delivering remarks at the opening, Dr. Anthony highlighted the government's effort to ensure health equality while reducing maternal mortality.
Unfortunately, last year, we had about 14 maternal deaths across the country. And that's a reduction. And of those 14 deaths, we have a lot of deaths that were recorded as indirect deaths, meaning because they didn't come and access care before, and they came very late, and at that point when they came, not much could have been done for them to prevent the complications. It is recorded as indirect deaths. And in some cases, the mothers were pregnant and died from another cause, resulting in this indirect death. But it still is recorded as a maternal death. So when you disaggregate this number, it's a little bit better than previous years, but we still want to work to get as close as possible to zero debt.
The minister also commissioned the Arukamai and Imbotiro health posts within the region valued at approximately $14 million. This wraps up our weekend review. Thanks for joining us and stay tuned for more updates.